Think about any professional relationship. What really makes it work? Sure, there are written rules, the things you can see on paper, and then there are the unwritten rules, the ones everyone just knows. The relationship between a doctor and a pharmaceutical representative? It's shaped by one of these powerful unwritten agreements. We call this the implicit professional contract. It's at the heart of everything. It's not a document you sign. There's no paperwork. It's a code of conduct you live by every single day. This contract is built on something deeper, mutual understanding and respect. The doctor, without saying a word, agrees to give the representative their time and attention. In return, the representative promises, again implicitly, to offer something of real value. And that value? It's not just a free sample. It's not just a pen either. It's credible information, something that helps the doctor make better decisions for their patients. This contract? It's the very first step to success in the pharmaceutical world. Break this unspoken promise, and you lose the doctor's trust. And once trust is lost, it's almost impossible to win it back. The doctor's clinic is a sacred space. It's a place of healing and of science. Your entry into this space, it's a privilege, not a right. The contract says you must honor this privilege. You're not just a salesperson, you're a conduit, bringing critical medical information to the doctor. Your role is to support the doctor, not to interrupt or inconvenience them. Every interaction, every single one, either strengthens or weakens this fragile, invisible bond. Understanding this, that's the difference between a successful career and a series of closed doors. Every doctor shares a set of fundamental expectations, no matter their specialty or where they practice. These are the non-negotiables of the doctor-rep relationship. The first and most important is absolute respect for their time. A doctor's schedule, it's a complex puzzle. Patient appointments, emergencies, admin tasks. Arriving on time? That's just the bare minimum. Be prepared. Meetings can be cut short or rescheduled. A true professional? They stay flexible. Keep your presentation sharp, focused, and always within the time given. Never overstay your welcome. Deliver a powerful message in just 5 minutes. Don't give a rambling 20-minute monologue. The second universal expectation, scientific integrity. Meet Dr. Anjali Sharma, a dedicated physician at the heart of a bustling Mumbai suburb. Her clinic is always alive with energy, and every day brings a new challenge. On any given day, she might see 50, sometimes even 60 patients. The pace is relentless. From the common cold and fevers to hypertension and diabetes, her waiting room is always full. There's never a quiet moment. Her day is split into 10-minute windows. For Dr. Sharma, every treatment must be effective, affordable, and above all, safe for her diverse group of patients. She's the first line of defense for her patients, their primary gatekeeper, and she takes that responsibility to heart. So, if you want to connect with her, be quick, be relevant. Show her how you can help manage her patient load, not add to it. Tailor your approach to fit her world, her reality. She's looking for practical, immediate benefits, solutions she can use right away. Imagine you're introducing a new combination antibiotic. Don't start with the science. Start with her problem. What's on her mind today? Good morning, Dr. Sharma. I can see how busy you are. I'm here because antibiotic resistance is becoming a real challenge for all of us. Our new drug has shown a 95% success rate against common respiratory infections in this area. Recent data backs it up. That means fewer patients coming back with unresolved infections. The real advantage? It's simple. Just 1 dose a day for 3 days. Here's a dosing card for your patients and the latest local antibiogram data to support your decisions. Now, let's turn to a different kind of specialist, Dr. Vikram Singh, a top diabetologist in Delhi. Dr. Singh's practice is a world apart. He sees fewer patients, but each visit is longer, more detailed, and often more complex. His patients are managing diabetes for life, often with several other health issues to consider. Dr. Singh is a true expert. He attends international conferences, keeps up with the latest journals, and expects the same level of expertise from you. He's focused on long-term outcomes, cardiovascular safety, and the finer points of clinical evidence. His unspoken contract is clear. Show me you're as much of an expert as I am. Good afternoon, Dr. Singh. I've been following the latest ADA conference discussions on cardiovascular outcomes in type 2 diabetes. Our landmark trial showed a 22% reduction in major cardiovascular events over 5 years. This could be vital for your patients. With this approach, you immediately position yourself as a peer, someone who truly understands his clinical priorities. The conversation should be a two-way data-driven dialogue, not just a sales pitch. And when you wrap up, don't push for a prescription. Instead, offer partnership. Share the full publication and invite him to a webinar with the study's lead investigator. In the world of medicine, some roles carry enormous weight. Surgeons and oncologists, every decision they make is high stakes. Every move demands absolute precision. Take Dr. Menon, for example. He's a top orthopedic surgeon, known for his expertise in knee replacements. For Dr. Menon, what matters most? Surgical outcomes. He wants to minimize infection, reduce pain after surgery, and help his patients recover quickly. His focus is sharp. He cares about the products used before, during, and after the operation. Nothing else. His unspoken contract is simple and direct. Will your product make my surgery safer, faster, or more effective? That's all that matters. And he expects proof, hard, reliable data, nothing less. Don't waste his time with anything else. The same goes for oncologists like Dr. Bose. Every day she faces life and death decisions. She relies on evidence, global phase 3 trials, the gold standard in medicine. For Dr. Menon, if you're pitching a new surgical antibiotic, you must show clear, surgery-specific benefits. Be concrete. Dr. Menon, our new single-dose antibiotic keeps therapeutic levels in bone tissue for over 8 hours, twice as long as the usual options. That means 40% fewer infections after knee surgery. And it's published in the Journal of Bone and Joint Surgery. Out in the field, you'll face questions, sometimes tough ones, from doctors. It's part of the job. It's vital to know the difference between an objection and a true no-go condition. They're not the same. A no-go condition is a real, unchangeable barrier, like a hospital formulary that doesn't list your drug. There's nothing you can do, at least for now. In those cases, there's simply no path forward. The professional thing to do. I understand, doctor. Since your hospital doesn't have this on formulary, I'll work with the committee. Move on with respect. But an objection? That's different. An objection is just a request for more information. It means the doctor is engaged, thinking about what you're saying. In fact, an objection is an opportunity. It's not a rejection, it's an invitation to go deeper. In India, most objections fall into 3 main buckets. Economic, your drug is too expensive. Scientific, I'm not convinced by your data. Or habit-based, I've used this drug for 15 years. Spotting the type of objection is step 1. Each one is a puzzle. Shift your mindset from defensive to constructive, and you'll find the way forward. When it comes to handling objections, there's a simple, powerful tool, the ACRC framework. It's your roadmap for every tough conversation. If a doctor raises a concern, don't worry. Instead, lean on this structure to guide your response and keep things on track. ACRC stands for acknowledge, clarify, respond, and confirm. Each step matters. Let's break them down. First, acknowledge the doctor's concern, then clarify what they really mean. Next, respond with relevant information. Finally, confirm that their concern is addressed. This approach shows respect and builds trust.
Let's see how this works with a common scenario. A doctor says, "Your antihypertensive drug is too expensive for my middle-class patients."
I completely understand, doctor. Affordability is crucial, and I appreciate you sharing your concern.
This simple acknowledgement lowers tension. You're not arguing, you're showing you care about the same issue.
When you say expensive, doctor, are you thinking about the monthly cost or comparing it to older generics?
Clarifying is key. Their answer tells you exactly what to address, so you don't waste time on the wrong point. Now, respond with value. Don't just defend the price. Explain the benefits and the bigger picture of total care. While the per-pill cost is higher than amlodipine, our drug provides 24-hour control with a single daily dose. That means better adherence and 30% fewer hospitalizations for hypertensive emergencies. As the study shows, even if the monthly cost is higher, the overall cost to the patient and the healthcare system drops by preventing complications. Does this perspective on long-term value help address your concern about the initial price, doctor? Beyond ACRC, there are advanced strategies to build even deeper trust and value with doctors. The value over volume approach focuses on clinical outcomes, making price less of a barrier. Quantify value in ways doctors care about, like fewer side effects, better patient compliance, and lower risk of complications. Use social proof. Leading cardiologists at Apollo and Fortis have adopted this drug after reviewing the cardiovascular safety data. Radical transparency means being honest about weaknesses. 5% of patients had mild nausea in trials, but it resolved in 90% of cases. We recommend starting with a lower dose. By being upfront, we set expectations and improve adherence. This kind of honesty builds lasting trust. Welcome to the Manager's Playbook, where building a team of champions starts with you. Let's talk about what it really takes to create a winning team. Great pharmaceutical sales teams aren't born. They're made. Go beyond just tracking numbers. Step up as a coach, a mentor, and a motivator. Start by building a living, breathing objection library. After every meeting, encourage your team to share the real objections they faced in the field. Make it a habit. Sort these objections: economic, scientific, habit-based, or competitor-specific. Understanding the pattern is the first step to mastering the response. For each objection, work together to script the best responses. Use frameworks like ACRC, and don't be afraid to try advanced techniques. Collaboration is key, but the real magic happens in role play. Reading about objection handling isn't enough. Practice, practice, and practice some more. Keep going until responses become second nature. Dedicate time to realistic scenarios. Make it as close to the real thing as possible. Have one person play the skeptical specialist, another the busy GP. Let the representative handle objections live, just like in the field. Record these sessions. Give specific feedback. Was the acknowledgement genuine? Was the clarifying question sharp and on point? Was the response focused on value and backed by data? Consistent practice builds confidence and muscle memory. Real coaching happens after the call. Go with your team, observe quietly, and let them take the lead. Remember, never take over the meeting. Let your team learn by doing. Afterwards, debrief together, in the car or over a cup of tea. This is your golden moment for coaching. Ask, what went well? What was the toughest part? Talk through the doctor's objections and how the rep handled them. Dr. Desai said our drug was too new. You presented the trial data. That was great. Next time, try acknowledging safety concerns first. One-on-one coaching is what turns good reps into great ones. Invest in your people. Reward the right behaviors, not just the sales numbers. Did someone change a doctor's prescribing habits through value-based selling? Celebrate that. Did a doctor praise a team member for their scientific knowledge? That's a win worth sharing. Share every success with the team. Let everyone learn and grow together. Build your objection library. Insist on real, rigorous role play. Give real-time, honest coaching. Celebrate every behavioral win, no matter how small. This is how you build a team of true champions, trusted partners to the medical community, who know that every interaction can strengthen or weaken the invisible bond of the implicit professional contract.